back here at B1, which is our cheekbone, where we have the most prominent of our zygomatic arch. And we're going to put a little bit of Voluma. We don't need a lot with each little aliquot injection. We're going to start to see sort of a rebuilding. And her cheekbones are actually deeper. We see that in some people, and now we're going to ice again. How did that go?
I honestly, guys, do not feel one thing. I feel the nice cold ice.
Yeah.
But other than that, nothing.
Okay. By putting these little aliquots, almost like beads, down deep onto the surface of the bony zygomatic arch or cheek, what we're going to do is we're not only going to get some instant fill from this product, Voluma, but it's going to lift the lower face as well. And you're already starting to see some of that lift effect. And then the other thing is it will actually stimulate some of her own bodily collagen, because there's a little layer of tissue that sits on top of the bone called the periosteum. That little membrane is great if you can kind of prick that just a little bit as you inject any filler, but inclusive of Voluma, you can actually stimulate her own collagen formation, and that's called collagenesis, neocollagenesis. Anytime you can stimulate the body's own collagen, it's kind of a benefit because of the fact that it does actually last a lot longer than even some of these long-lasting filler products. This particular product, Voluma, is going to last about 2 years, up to 2 years. Now, of course, we're not going to want her to get back down to empty. We're going to want to keep up with her aging process, but I'll put just a little bit more back here. Just everybody, if hopefully you're seeing that difference from one side to the other, we'll kind of do a good head-on shot. So you can see the difference from her right treated side to her left untreated before we start doing the same thing on that side. But that's pretty much, that's one syringe. We're going to be massaging it deeply just to make sure that those little aliquots are nice and smooth.
I'm 34, I'll be 35 in October.
So, not too much, because she's already getting that kind of, just kind of diffuse, kind of flattening across the mid-face. So I think that's also a common question, and people say, what about me? Am I too young? And I think you just have to really look at the facial anatomy of that specific individual, because she needed this, and I think it really gave her that little lift that she needed. All right. We've